Brilliant. I don't feel like I need to give my talk now after that introduction, because that feels like that is my research journey. So this is a topic, again, that I've got a lot to say, and so I'm going to try and keep it to the 10 minutes. So we've been asked to talk about developing research in health and social care and my perspectives as a physiotherapist. Often, allied health professionals are all bunched together, and it's about our journey as allied health professionals, nurses and midwives. But I think there's actually very distinct challenges for each of the different professions in terms of navigating that journey. So here we've got a picture of what I consider to be a frontier crossing a mountain. And I see this as represents really how my research journey has been, trying to navigate really research between the NHS and academia. Where should I be positioned? Am I best working in practice? Am I best to be in an HEI? Because they all have their advantages and disadvantages. And now the new frontier challenge for me is linking with social care as well, as we sort of move our research, which is really important around the care of people as well, and moves beyond health. So when I started in clinical practice many years ago, I had lots and lots of unanswered questions. I was a real pain to work with, and I on the nerves of my colleagues that I worked with at the same banding as me, but also the people that were managing me, because I was never happy. I always wanted to know, why are we doing this? Can't we do it my way? Why can't we do it my way? This looks better. And I went through 5 jobs in 4 years. I just couldn't settle anywhere. And then I saw a MSc advertised at Cardiff University at the School of Healthcare Sciences. And it kept jumping out in what they described about research and solving problems and doing a project to answer questions and critical thinking. And I thought, maybe that's what I need. And it was through doing that master's and following on from that I was absolutely determined that I was going to create a research pathway within my career. And that's just kind of expanded as the years have gone on. And I would say that there's been no guidebook as to how to do that. And I think there is still no guidebook. A lot of these careers develop because of the individual and the chances or opportunities that come their way. Okay, so my biggest success is probably my most recent success, and that's that I finally got awarded an NIHR HTA grant as a co-chief investigator. So this I see as a success because I really think this is probably the project where I really think will make a difference to people's lives. But also for me and my research career pathway, it's that I feel like it's a big rubber stamp of saying you're finally a researcher. And it's taken to this point for me to actually probably feel confident enough to really be able to say that I am a researcher. Navigating around funding has been something that's probably defined what I've done over the years to get to this point. So to get to this point and to be able to work in research, I think we've been asked to give some tips of the skills that people probably have helped me along the way. So number one, I think the skill that I just had was asking questions and trying to look at things differently. That's just something that I naturally did as a physiotherapist. But I think that's the number one important skill, and it's a skill that I would say it's really important not to knock that out of people. I think that's really, really important. One of the things that's also been said is that you need to have a research mentor. And more recently, you hear about having a mentor, and that's really important. And I would say people have been very important in the opportunities and the development of my career. But I've probably never had an official mentor. I've always been scared to say to people, will you be my mentor? Because they'll think about what time is involved or the commitment, and they would back out of it. So I probably look upon it more as having research friends Going and having coffee with people who I would really like to learn something from. And so that's helped me develop myself, and that's been really important. I guess it's about me developing myself and finding those people to be able to talk to. One of the other important, skills and achievements was getting a PhD to be able to further my research career. It wasn't something that I actually thought I wanted to do, but I was told that if you don't get a PhD, you are going to be capped in what you can do. But I would encourage people to think creatively about how they do a PhD. There are a number of opportunities. And probably the other thing that's been very important to me has been around writing as I've gone and developing my profile of who I am in terms of having papers, small amounts of money, getting on funding as a co-applicant, so that I've built up my credibility as I've gone along. The big challenges I've faced is navigating research, navigating between HEIs and funders, and working within the NHS. It's been exciting, but like I've said, there is no map for that. Funding has always been something that's worried me. I was told early on in my research career in the NHS, if you don't have any money, you can't do research. And I've always taken that as being very important and taken that to heart. And I see that now as core to what I do. I think as an allied health professional, sometimes doing that very applied research, it's been challenging to get funding, but I think that's changing. And I think Health and Care Research Wales, in terms of the awards that are now available, are excellent opportunities for people to be able to develop themselves and their research. And one of the things that I've probably struggled with is being confident. I often need a push to go and do things, or to think that I'm good enough to be able to apply for something. And so I think that's always the challenge. And I didn't do a science degree, so probably that's something I've always struggled a little bit with. How can I be a researcher? Because I did a degree in physiotherapy. I didn't do a science degree. And so that's been a challenge to overcome. So reflection and advice. So one of the things I think is really, really important in developing yourself and your research career, but also developing your research, is to speak to lots and lots of different people. Listen to what they have to say. If it's about developing your research idea, it's speaking to those people that are in that area and listening to their wants and needs. And the same, I guess, really applies when you're developing yourself as a researcher. But you've got to be able to, I think, especially when you're developing yourself as a researcher, is to be able to apply a filter to what people are saying to you and just really be able to make it work for you. My second piece of advice, probably the most important piece of advice, is don't give up on a good idea. If it doesn't get funded the first time, you've already put a lot of work into that. It doesn't mean it's not going to get funded. Keep going, but do take on board any feedback and do get people to read your work, get used to talking about your idea. Do people understand it so you can reinvent it and reapply? And I think the other piece of advice is be prepared to keep evolving and learning. I think research is changing all the time, opportunities are changing all the time, and it's important to sort of embrace that and take the opportunities that can come your way through that.